Polypharmacy is classically defined as too many medications. And we don't know exactly what that cutoff is all the time. Most people say it's going to be 6 or more medications, and so that's what I use. If somebody's taking more than 5, then I say they have polypharmacy. We'd also consider it if somebody has a lot of different providers prescribing all of the different medications for the person, or if we don't have a good indication for why the patient is taking a medicine, even if they're only on a few.
As you increase the number of medicines above 5, the chances of the next medicine improving your outcome are about 25%. The chances of the medicine causing a side effect are about 25%. As often happens in older people, they get on many medicines which have minimal positive effects.
Hello, Mrs. Fay?
Yes.
Hi, I'm Dr. Little.
Hi, Dr. Little. It's nice to meet you.
Nice to meet you as well. So how can I help you today?
Well, I took a fall and I'm still moving around. I don't know if I hurt myself, but I thought I should come in.
So whenever I see somebody who comes to me with a fall or a near fall, the first thing I do is look at the medication list. So let's look through your medication list together.
Okay.
You take a medicine for your high blood pressure.
Yes. I take that every morning.
Okay. And I see that your blood pressures, you've marked here that where you've been taking them for the last several months. So that's good that you've been checking your blood pressures at home as well as here. So what was wonderful in Mrs. Fay's situation is that she was able to bring me an accurate medication list that included all of her supplements and as needed and vitamin medications that she took. And in some situations we don't have that list and it makes it a lot more challenging. So I always encourage all of my patients to bring in an accurate medicine list and or their actual pill bottles that we can review together. And then I see that you're on a blood thinner.
Yes.
And what is the reason you're on that blood thinner?
I have an atrial fibrillation.
Okay. And then I'm very interested in the medicines that you take as needed. So I see that you've been taking Xanax.
Yeah. That's, kind of up and down whenever I need it.
When I first saw the medication list for Mrs. Fay, there were some medicines where it wasn't clear why she was taking them, so it was very important to talk through them with her, make sure we had the right dosages, the right time she was taking them, and the right reason for why she was taking them, especially for the medicines that were as needed, where it's not clear if she hardly ever took them or took them on a regular basis. Also says here that you take a medicine called carisoprodol. That's a muscle relaxant. How often do you take that? Muscle relaxants are used very frequently in a primary care practice, and in older adults they can be quite dangerous because of the risk of confusion and the risk of falls. And so somebody may have been on it for many years for a pain problem or muscle spasms, and especially if it's on an as-needed basis, we often kind of disregard those and we don't think about them very much, but we should be very critical. And I see that you also have some arthritis. What do you take for the pain for that?
What is that? Ibuprofen?
Ibuprofen?
Yeah, that helps.
Do you take anything else for your pain?
Oh, Tylenol PM.
Oh, you do take the Tylenol PM?
Yeah, yeah.
Okay. Are there any other medications from any other doctors or vitamins, supplements, herbs that you take that are not on this list?
No.
One of the things that I would like to do is to review your medication list with our pharmacist that we have here in the clinic.
Oh.
And then I will come back and I will review everything that I would like to do to try to prevent any more falls in the future. I also wanted to get the consulting pharmacist involved because when we start to see a lot of those medications piling up, it can be very complex and lead to situations such as falls, delirium, or other geriatric syndromes that we would like to prevent. I have a complicated case here of a woman who had a recent fall and a near fall last night, and that's a copy of her medication list.
So, Dr. Little, I was wondering, do you have any possible blood pressures?
Yes, I do have a
her?
few, and she takes them at home as well, which is good. We have 126/78. We have a 115/85 at home, and another home reading of 120/82. And the one here in the office was standing up.
Okay. So she's about 85 years old or so. That seems a little low for a woman her age.
It does seem a little bit low.
I was very concerned about several of her medications. Number one was her use of hydrochlorothiazide, and in relation to her blood pressure recordings that she brought into the office to share with Dr. Little. Low blood pressures in the elderly population can increase fall risk, and low blood pressures are associated with decreased organ perfusion. And so in the elderly population, we tend to have blood pressures run a little bit higher than the normal average adult. I'm also looking, she's on fish oil. She's taking fish oil daily as well, and she's on warfarin. We have to be careful with that, especially with her falling, because fish oil does can increase bleeding and increase her INR.
The primary decisions we made were to drop medicines that either no longer had a benefit for the person, such as maybe some preventative medicines like the omega-3 fatty acids that may or may not at this point have a benefit, considering the potential interaction with another medicine.
This alprazolam 0.25 up to 3 times daily. Is she taking that?
She does, and she actually takes it several times a week.
Okay.
She wasn't sure if she took it that morning, but she did say that her anxiety has been increasing recently.
Well, benzodiazepines, especially in her the age population that she's in, it can be quite sensitive to the side effects of benzodiazepines. I'm hoping that maybe we could think of non-pharmacological ways to help her handle her anxiety. And ibuprofen, it looks like here that she may be taking this as well for some pain issues. That, along with her warfarin, sends up a red flag to me, especially if we don't know how much she's taking, if she's not very clear and it's not a consistent dose. Her use of ibuprofen, along with her blood thinner, was a concern to me, especially it wasn't even a consistent dose. It was varied throughout the week. And that medication alone, not even without a blood thinner, is a red flag in the senior population because of its increased risks. It has risks associated with GI bleeding, it can worsen renal function, and it also carries some cardiovascular risks.
The other problem that I see, she did tell me that she was taking Tylenol, but then she told me it was Tylenol PM that she takes to help her sleep at night.
Okay.
So she's not consistently taking just plain Tylenol, it's the Tylenol PM, and all of those combined together worried me a lot.
Diphenhydramine is strongly anticholinergic, and what I mean by that, it can cause dizziness, confusion, dry mouth, a definite fall risk medication. It's just, we try to avoid that in that population.
So I spoke with our consulting pharmacist, and I think we have a wonderful plan for your medicines right now.
Oh, good.
I think you'll be happy because we're going to be able to cut back on a lot of things that you've been taking.
Oh, I'm glad to hear that.
I find it very helpful to consult with a pharmacist because they learn aspects of medication that may be a little bit different than how I learned it. So while I had ideas of what I felt would be important in adjusting a medication list for Mrs. Fay, there were additional things that the pharmacist helped me to figure out. So when we make simple changes, for example, stopping the high blood pressure medicine when there's a risk that the blood pressure is dropping when somebody stands up, we can prevent a lot of falls. So taking the time to review the medications, to stop some of the high-risk medications, really makes a big difference in reducing falls in the future.
Pharmacists do a phenomenal job because they're the experts in this area. So in a part of a team, it's absolutely essential that a pharmacist reviews these medicines, over-medication is a rampant problem in the United States, and really we need to spend a lot of time recognizing that we cut medicines to only the ones that are absolutely essential.
This graphic shows the medications that Mrs. Fay presented to her physician during this visit. Following a consultation with the clinical pharmacist, a decision was made for some of these medications to be removed, and there is one substitution. You'll notice the retained medications moving to the right of the screen. A total of 6 medications were dropped from her total list of 11 at the start. A new medication for pain was added. The final list of medications corresponds with practice guidelines to avoid polypharmacy.